Assalamualaikum warahmatullahi wabarakatuh. Good evening to all the participants. Salam sejahtera dan salam sehat untuk kita semua. This session of guest lecture session. This session of guest lecture is still related to our National Health Day, which actually we celebrated on November 12th. There are two guest lecture series will be conducted related to this National Health Day. Today we will conduct the first series, and next week on November 26th we will conduct the second series. The big topic of this guest lectures series is effect of physical inactivity to the health of children to geriatric population, a pandemic threat. We have a speaker today in this guest lecture today, Professor Dr. Nahar Azmi Mohamed from University of Malaya Medical Center. He will bring the topic which title is similar to the big topic of guest lecture series, but with emphasis in perspective and experience from University of Malaya Medical Center. We have an hour to conduct this session, consists of the presentation of Prof. Nahar, proceed to the Q&A session. Before we start, may I read the curriculum vitae of Prof. Nahar shortly. Professor Nahar, sorry, I have to read. Professor Nahar, initial career, it was being a house officer in Mohamed Malaka Hospital from 1996 to 1997, and now he is a lecturer of clinical specialist in University of Malaya Medical Center. As appointments, he is as a head of sport medicine UMMC from 2012 to 2023, as a head national sport medicine specialist board from 2016 until now, and the chairman of MMC Sub-Education Committee for Sport Medicine from 2020 to 2024. As a visiting sport medicine consultant in Institut Jantung Nasional from 2020 to 2024, and as a National Coach Academy Advisory Board from 2020 until now. And the last is a member of Malaysia Physical Activity Guidelines. I now invite Professor Nahar to bring your presentation. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Can you hear me?
Yes, I hear your voice clearly.
Okay, thank you very much, Dr. Nora. Yeah.
Yeah.
All right. Shall I share my slide?
Yes, please.
Yeah. All right. Can you see my slide?
Yes, I have seen your slide, Prof. Nahar.
Yeah. Okay, sure. So again, Assalamualaikum warahmatullahi wabarakatuh, and very good evening, I suppose, to everybody in Indonesia. It is my great pleasure and privilege to be invited as a guest speaker for the session, one of the session in Universitas Indonesia, Fakultas Kedokteran. I'm humbly honored for this invitation. So let me proceed to this topic. So the topic for today, effect of physical inactivity to the health of children to geriatric population and pandemic threat, the perspective experience from UMMC Medical Center, University Malaya Medical Center. Again, before I forget, thank you, Dr. Nora, for your kind introduction. Okay, I shall start with okay, initially everybody's talking about being physical active is always been you know, the way to reduce the risk of to gain health benefits, yeah, by being active. But that is no longer sufficient just to meet up minimum level recommendation by health guidelines in order to reduce our cardiovascular risk. The reason why there's quite a number of a study looking at despite being physically active and meet the minimum recommendation, being physically inactive and also sedentary behavior may also contribute to our own health hazards. So again, it's not just being active alone, but we need to reduce our physical inactivity at the same time, because as I mentioned just now, being physically inactive and also when you're continuing behavior of sedentary behavior, it may increase your risk of health. So coming back, physical activity versus physical inactivity. Now looking at the key fact given by WHO, yeah, these are the normal, what we call everybody knows about the significance of being physical active and the benefits out of that being physical active. Prevent managing non-communicable disease and reduce health well-being. And now, because of the current situation of pandemic of COVID, the increasing number of mental health. So being physically active may contribute towards every individual to lessen stress and reduce the risk of mental health. So these are what we call the norm of the key fact highlighted by WHO in terms of by being physically active. So there's the common what we call definitions of being the definition of physical activity, any just physical movement. But if you are defined by exercise, so it will be any form of structured form of activity, and it will conducted between a moderate to vigorous type of intensity level. So these are way of how individual can improve the health. Of course, looking at different age group, yeah, WHO or even earlier American College of Sport Medicine, American Heart Association, and updated by WHO in 2020 in regards of physical activity recommendation according to each age level, from children to adult to older adult. So more or less recommendation towards adult and older adult, not much difference, yeah, in terms, just the difference is prescribing individual in terms of the intensity level. But of course, if you are looking at the children and adolescents, the requirement of being active at least 60 minutes per day is recommended. And of course, there are also other form of type of activity that recommended for each group of age. But looking at current situation where the high numbers of people inactive. Of course, despite being minimal, able to achieve minimum level of guideline, but still high number of high duration of physical inactivity. So it's challenging with current situation, and especially during the pandemic, where most of countries, even now in China, lockdown is still implemented due to the currently increasing number in COVID-19 cases. So try to improve individual physical activity level is challenging. So if you want to, for those that not been active before and try to be active and try to fulfill the recommendation at one go is totally difficult. So what's the WHO emphasize on at the very beginning to encourage individual to able to become active, we start with very minimum of step count, or what you call every step count. So do something better than nothing at all. So in relation of the publishing of WHO physical activity and sedentary behavior guideline to combat the health issue, they start encouraging everybody to at least to increase movement. So that's where every steps count. So going back to the topic of today being physical inactivity, which now is the fourth, what we call that, in the WHO list of burden of increasing number of, what we call that, okay, coming back to physical inactivity. So insufficient of physical activity level to meet present physical activity recommendation is what is being defined, yeah, definition of physical inactivity. Of course, with urbanization, with increasing number of technology, with a lot of gadgets, assist us to make our life easier to perform our daily routine. But on the other hand, with technology, it makes us a bit lazy and make us a little bit of inactive in a way where for work demand, everybody need to complete or to achieve their goal or achieve their work as soon as possible, and they have to spend time on the desk, and also they need to, what do you call that, spend hours, yeah, to get things done. So it make them inactive or throughout the day, or for example, getting up early in the morning from 5 o'clock, get things ready, reach at work and start working, and after that get back home without doing any form of physical activity exercise other than the routine of walking during at work. So perhaps that's not sufficient to achieve the recommendation recommended by WHO. And then furthermore, with the technology where you have lift, you have escalator, that make even the situation worse than encourage people to be inactive. So there's a key fact, what we call that, in terms of physical activity by WHO. They formulated that more than a quarter of the world adult population are insufficiently active, and 1 in 3 women and 1 in 4 men do not enough physical active to stay healthy. And level of inactivity are twice as high in high income countries, and has been no improvement in global, since they have started monitoring this since 2001. So not much improvement on how to increase physical activity level among individuals around the world. And insufficient activity increased by 5% from between 2001 to 2016, and more than 80% of the world adolescent population is insufficient physically active. Coming back to physical inactivity, is been listed as the 4th leading risk factors for mortality. So this example of publication from Canada, looking at how much cost contributed by being physical inactivity in health care costs. So looking at this, the estimated direct, indirect, and total health costs of physical inactivity in Canada is actually is high. So looking at this, so it's very important. The reason of this what we call that paper published to inform that being physically inactivity contributed towards a high increasing number of non-communicable disease, and that's where a cost for treating or providing services to individual to get better from the disease, that's where lead to high increase of cost. Looking from this paper, looking at physical inactivity, also noted that by being physical inactivity is contributed towards a risk of diseases, especially non-communicable disease. I would like to share this actually one of the paper from our study, our cohort study run by the team of UMMC Malaya. We comprises of a different discipline, from social preventive medicine, a dietitian, pediatrics, sport medicine, and a number of other disciplines, where we are looking at adolescents. At this point, we are monitoring a group of students from the locality is actually in Klang Valley, not in Klang Valley, in Malaysia, but we chose a few sample of area where we go to the school. A number of school been identified after we randomized, and then we managed to collect about 1,071 so-called healthy students. So from the age of 13, and we follow them until the age of 15. So this is actually a paper we're looking at what you call that in terms of their activity level. So what are the tools that we use from our perspective? So in terms of questionnaire, we use Sp.KO. Yeah, well, Sp.KO questionnaire. And for the fitness assessment tools, we use step test with modified Harvard protocol. So each of the individual, other than we collecting all quite a number of questionnaire, other than the dietary questionnaire, physical activity questionnaire. As I mentioned just now, we use Sp.KO questionnaire. It has been validated. Of course, we use the one that translated into Bahasa Malaysia. Initially was translated by a researcher from University Pertanian Malaysia, and then we used and it has been validated and done reliability. So we use that. We use that questionnaire in our study. So we gave the questionnaire to the student. Of course, because they are underage, we need to get consent from the parent. Just to let everybody knows that during the data collection, when we go to the school, we have informed the school that these are the questionnaire that we're going to give to the student, and they need to get consent from the parent for the approval. So quite a number of parents are not agreeing. So, but majority of the parent agree for their children to get involved with the study. So we give them, and then when they come, we take a few blood tests, some blood tests we took, and also we do the fitness so-called assessment. So in terms of fitness assessment, we do height, weight and weight measurement. Of course, weight measurement, we do bioimpedance analysis with a Tanita machine. And then we do our so-called fitness assessment with step test using a modified Harvard protocol. So with modified Harvard protocol, the student need to perform the step up, down, down for 5 minutes. But the good things about modified Harvard, the student not necessary to complete until 5 minutes. There are quite a number of them unable. So of course, for those that quite obese, yeah, they are unable to complete for 5 minutes. Then they can stop at any point of time. But then we took what we call the recovery heart rate from 0 to 1 minute and 2 minutes. From then itself, we collected almost all students in terms of their fitness level. Okay, from one of these paper published looking at the risk, yeah, the composition and with the heart rate. So we able to conclude that because the other not to say problems that this current system where supposedly the children, I mean school children need to have so-called physical education or physical exercise at school during school hours. Supposedly, even during my time, we have about 2 sessions per week and at least about 30 to 40 minutes. But despite it's in schedule throughout the week, most of the school during the what you call the physical education session, they fill it with teaching session, just try to finish up the syllabus. So from then itself, we acknowledge and we notify that most of the school not comply with what do you call that, the recommendation that the student need to perform and need to get physically active even during school hours. So we managed to identify that, and of course the reason of this study also to give recommendation to the Ministry of Education in regards of the reason why the level of fitness and health status, looking at the increasing number of obesity in children is high, and part of the problems that we encounter was of course the dietary component, where the canteen which provide the food to the student was not being monitored properly, and they allowed there's no what we call that sufficient healthy food. And of course another component is the physical activity component, which is not being implemented totally. So this is part of what we call that why the results of looking at the body composition measurement and heart rate apparently among healthy adolescents was not really good. So we able to identify this. Supposedly the program, this what we call that cohort My Heart study, is meant to be nationally conducted by other university, but finally it's only in Malaysia conducted this so-called project. We just actually we completed this project in 2018, and then later on we continue with another project with the same data, what we call My Heartbeat. We collaborate with a team from UK, but this is actually one of the paper that come out of that project, looking at being physically inactive for among children and adolescents at this what we call that project we had is focusing more on adolescents from 13 to 15. So this the early data we collected at the age of 13. Okay, now coming back to earlier statement, both physical inactivity and sedentary behavior have their own health hazards and need to be addressed separately. Definitely, we need to look at this, not just encouraging individual to be only active and comply with the recommendation given by WHO, but to encourage individual also to be to reduce what we call the sedentary time or sedentary behavior, or being physical inactivity throughout a longer period of time. So most of us, if let's say unconsciously, when we commit to our work, we may spend more hours on the desk just to complete our assignment, without knowing that by the time we completed, we already sitting for more than 2 hours. So basically, we need to reduce our so-called sitting time as part of to reduce our physical inactivity. Come out from the physical inactivity statement from WHO, as I mentioned just now, due to work or even sometimes being relaxed at home, not doing anything, you know, at one point of time, you may spend hours without realizing that you're being physically inactive more than 2, 3, 4, or even more than that. So a few numbers of study looking at this and highlighted on if more than 10 hours a day, of course, in terms of risk of what we call non-communicable disease increase, and at the same time increase of health costs. This one example of paper mentioned and highlighted that sedentary time and being physical active are basically independent. So this is actually as a statement to support what being highlighted earlier. So when you are being physically active, even despite you comply with the recommendation of at least 150 minutes per week moderate intensity, or you're doing additional with other type of form of exercise like add on flexibility, strength, and also balance. But then when the being physically inactive while what do you call that, being not active more, even as mentioned earlier, even more than 10 hours, so the risk is still there. So so how we going to go about to fight this what do you call that, we call it pandemic, is because not just in only one or two countries, almost everywhere around the world will experience this what do you call that, conditions of physical inactivity and increasing number of non-communicable disease due to physical inactivity. So it should be done everywhere, and of course at one point for each country, perhaps it's not just only one body or one organization should what you call take the responsibility. It should be everybody, in terms of from nationally, from the top management, the top what do you call that, maybe from the policies itself, and then from private sectors, and even community need to take part in terms of how to implement and ensure each individual or everybody get the benefits to be physically active. Of course, when looking at awareness, I'm sure quite a number of awareness has been done even in Malaysia. Ministry of Health keep on have a billboard on saying, okay, exercise, you need to exercise 150 minutes per week, or at least recommendation of 5 times with 30 minutes a day, or it can be break down to 10 minutes at one session. I mean, you can break down a day from 30 straight continuously 30 minutes and break down 30 minutes at one time. You divide into 3 times a day, because it's a what we call as accumulation of 30 minutes later on throughout the day. So those awareness even encourage individual to increase their step from to achieve 10,000 steps a day, and quite a number of what we call that apps that available to encourage, even in the apps, what to call that, what Ministry of Health introduced to their staff or the healthcare professional healthcare individual where they have some kind of what we call that encouragement, where if they're able to achieve 10,000 steps a day, they will given a voucher of or discount point. So they collected it, then they can exchange this to whichever place that being appointed as part of the program. So Ministry of Health has a what to call that an app called an apps a special apps for Ministry of Health where they can download or upload it totally free for them, so they can and key in the data regularly. Even lately, recently, I was also involved in another project, collaboration project with University Kebangsaan Malaysia, where they created their own wristband, where it will collect steps other than steps. So the participant they can log in their so-called data of a diet, what they've taken throughout the day. So these are mode of what we call that ways of how to increase and encourage individual to increase their physical activity level, other than try to what you call practice a healthy diet. The other what we call that role, of course, looking at the policies what we call highlighted by WHO, these are actually some of what we call that policies that they highlighted. Of course, it also depends on each countries how much the government or the other sectors, private sectors or other sectors that may play important role to create the built-in environment to ensure the performing of physical activity safely among the individual or the citizen of the country. Of course, to build the facilities is easy, but the problem is maintaining the facilities. That is currently the situation happened in Malaysia. We have quite a lot of facilities available for many years, but some of the facilities is not being looked after well, and it's damaged, and then it's not have a good maintenance. And despite not good maintenance, individual kids, some of them still playing at that facilities, and it not safe. At the same time, it may create what we call that not injuries to the users. So which is actually that may create another reason why people are not keen to play or to get active, because of the facilities is not well taken care of. So despite all this, what you call that facilities, the availability of the facilities, even I did mention at school, when we did our study at school, we found that facilities not well taken care, and also despite having 2 sessions a week for physical education of exercise session for the student, but it's not being implemented well. So these are the things what we call that may contribute towards the physically inactive. Of course, bear in mind, I'm not representing what we call that on behalf of ministry. Yeah? So I'm talking on behalf of what our finding from our studies that we run the project at a few schools around central of Malaysia, which we collect our data around Perak State and Selangor State. Yeah, so out of that experience, we able to identify the problems that that had happened, why the number of what we call that obesity among adolescents partly not partly contributed by not eating healthy and also not being physically active. So in view of WHO plan, I'm sure some of you might be familiar with this global action plan, which they launched in 2018. So they have actually quite a list of what we call that target or plan. In terms of one of it is the built environment, where they would like where it's come from the policies itself. So it need to be in the policy, and where the government should be part of the important role of make the environment or of each country to allow the citizen to be physically active with safe conditions of whatever facilities provided. So their target towards 2030, trying to reduce the physical inactivity percentage by 15%. So I'm not pretty sure how current situation now, even from the data of we had what do you call that, national data, which I can share in 2019, the report where under what do you call that, Ministry of Sports and Youth, this under the subdivision of Institute Youth Research, where I'm one of part of the members of the project, where we collected about 10,000 data throughout Malaysia. Of course, it has been statistically what we call that distributed throughout the countries. So, for example, if let's say one state has a higher percentage of Chinese, for example, in Penang, so the percentage of numbers of population of Chinese in Penang will be much higher. And for example, if let's say a state of Kelantan, which has higher number of Malay, so that's where the percentage of Malay will be much higher in that state. So all the data came from all 14 states in Malaysia. So that's where the 10,000 what do you call that information of individual we able to collect it. So what are the tools? We created the tools and we have validated the tools under the Institute Youth Research of Malaysia. So where one of the what do you call that questionnaire that we ask to the individual first, do you exercise? The answer will yes or no. And secondly, so whether you do exercise regular, where this will follow the recommendation of 150 minutes per week. So whether it's more than 150 minutes or less than 100, between 30 minutes to 149 minutes, and less than 30 minutes. So the data is, of course, it's what we call that, retrospectively, but within 3 months. The reason we use 3 months, we follow the study done by Australia and also Singapore. They use what do you call that, recall back the information about physical activity they've done for the past within 3 months. Okay, so out of that 10,000, only 33%, about 33 to 34% of Malaysians comply with the recommendation of 150 minutes per week at least of moderate intensity of activity. So from then itself, if looking at the target launched by WHO in regards with global action plan, is still what we call that, far away, you know, in terms of to achieve 15%. But of course, when we talk about physical definition, physical inactivity by WHO, which is actually should physical inactivity, if you still can recall back, it didn't comply the minimum recommendation, which is actually 150 minutes per week. So from that itself, in ourselves in Malaysia is still far away. Whether or not we able to achieve 15% in 2030 is still a big question. But looking at now, the current situation, quite a number of what do you call that, NGOs promoting Malaysian citizens to become active throughout quite a number of activity, what do you call that, involved by organizing an event, either running, walking, cycling, triathlon, or even futsal, football. So these are the things that the way of trying to encourage Malaysians to be active. So what so far we have done in University Malaya Medical Center, of course, earlier, before 2010, before 2015, sorry, before 2015, we have activities, but it run by, of course, one of it, myself conducted the program, but it's not well structured. But after from 2015, where we the Department of Sport Medicine assigned to look after so-called activity, sports and physical activity of the hospital. That's where we have a program conducted accordingly at different level. So we have a top management exercise session where, meaning the top management is from the director itself, deputy director, the head of department, and also the head of unit of the hospital. Okay, so this program run every Tuesday morning and Friday morning. This for top management, but of course, recently we have what we call that some kind of encouragement to the head of department. If let's say they comply either by coming every Tuesday and Friday, but also if they come to the gym with their own time at their own free time and collected a number of credit that we have allocated. So if they are able to achieve throughout the year and achieve at least 60%, so the director agreed and is approved by the board members of the hospital director, where the head of department will give an extra 1,000 ringgit for the department for their staff allocation of training. So despite their current whatever that allocated budget given to the department, they will get an additional of 1,000 if the head of department able to achieve at least 60%. So this is how we would like to increase the physical activity among the head of departments. Second, we have also a program for our staff every Tuesday and Wednesday afternoon where organize Zumba. I will organize the session. Okay, we have what we call BFIT. BFIT is another program where we will announce through the Department of Sport Medicine every year. Every year we will announce once. So we will open up advertisement open to all staff. This program has been approved by the board members, board management of UMMC Malaya Medical Center. I mean, by the hospital, where one of the what do you call that perk that the staff will get, one, they allow to get out from their work about 1 hour just to come for 30 minutes of exercise. The exercise will be run by 2 of our so-called trainer. It can be in a group, a small group, big group, or they can come to the gym with under supervision. So if they able to complete the program of 6 months and have improvement, of course we will give some prizes for those that able, which we every year we will have our so-called ceremony where we will give the top 5 who able to complete and able to achieve their weights and also fitness. It's not just weight, but of course their fitness level. So we will give prizes, but at the same time they will get a credit point where it will included to their yearly what we call that credit requirement for the staff. So for example, one staff, they need to accomplish 40 credits for 1 year. So at least they will get, once they completed, they will get at least between 6 to 8 credits. So it saves their, what we call that, effort to take some courses to gain their credit. Kids Fits, we organize during school holidays to all children under endocrine clinic. So we are working together very well with pediatric endocrine and also with dietetic team. So school holidays will have a boot camp we run in the hospital. It's not a 2 or 3 days, but 1 day session from morning until maybe more than half a day. And also every Wednesday, we will have what we call that multidiscipline clinic session for the children from endocrine clinic. So we will have a session combined from the 3 teams. Of course, ESG, Exercise Support Group, even though it's cancer survivors, but most of the cancer survivors involved in our program, most of their age are more than 60s. So which indirectly, so all the group of individuals get involved in our activity. Of course, there are quite a number of non-cancer patient inquire to get involved. We open to some that willing to come. We conduct this session every Saturday. Of course, all of them is gone through under what we call the pre-participation examination before they're able to come to the session, because our session, when we first started in 2014, is quite light, 15 to 20 very low intensity session. But now, because throughout the year, most of the members are quite fit. So for those that newcomers, I have to screen them properly and then encourage them to follow at their own rhythm, at their own pace. And usually during the session, I will give a few modifications in terms of the type of movement they can do. They do not have to follow what I've demonstrated on the stage, and also don't follow other members that already but I'll just encourage them to move. So these are basically the program that we run. Of course, we monitored them for the ESG group every year. Kit fits we monitored for those that come on Wednesday. The cycle of the monitoring every 6 months. Be fit, the session, as I mentioned just now, is a 6-month period. So we have 3 what we call point of assessment: early, middle at 3 months, and 6 months. So we'll measure them not just what we call that fitness per se. Of course, their bioimpedance, their what we call that blood. Yeah, we also do basic blood monitoring, their lipid profile, their sugar level, HbA1c, and of course hemoglobin. So we basically will monitor that at 3 points. So those are the activities that we've been doing for the past what we call under structured program since 2015. So this is an example.
Prof. Nahar,
Yeah.
Excuse me, because of the time.
Yeah, I'm finishing. I just have another 2 slides. Don't worry.
Oh, yeah.
Okay.
Okay, please.
Just to show you the pictures. Yeah. So this is actually a program of the BFIT. So as I mentioned, so the activity it may conduct as in a group. Yeah. But it can also conducted individual. On the right hand side, basically, there are additional activity, hiking, and also climb Mount Kinabalu. Okay, this program for what we call Kids Fits, the Kids Fits program. Of course, this picture, the top 2, the orange color boys wearing the t-shirts, these are actually fitness tests for some what we call that school boys involved in sports. But if you look at the bottom, the very bottom pictures, so these are patients from endocrine clinic. Of course, these are the ESG. My heart and soul is with the support group for the survivors. So they are actually the one, because of them, ESG is always there, and always look up at them, because they are my inspiration all this while to keep on moving to continue the ESG. Okay, WOPAD is World Physical Activity Day. I'm sure maybe some of you might familiar with World Physical Activity Day. Is actually on the 6th of April every year. So every year we will have this session. We do a ceremony, and this is when we give prize giving to all those winners that are able to achieve their target throughout the program. This is the SG, and that's it. Thank you so much for listening. I hope that's something to benefit everybody.
Yes, thank you very much for your presentation. Nice, very nice presentation and very informative to us to know about the experiences in combating of the physical inactivity in Malaysia, Prof. Nahar. And before we proceed to the Q&A session, I want to greet Dr. Nani Cahyani as a head of sport medicine residency training program, Faculty of Medicine, Universitas Indonesia. And now we proceed to the. Hi, Dr. Nani.
Hi, Dr. Nora. Hi, Prof. Nahar. Thank you for the presentation. Can we proceed to the question and answer? There are quite a lot of questions, I believe. Yeah.
Yes,
Okay.
yes, there are quite a lot of questions, Prof. Nahar. First is from Anna, a sport medicine resident. The question is, how can we motivate, encourage elderly population with comorbidities who's scared to fall to be physically active?
Okay. This is actually a very good question. Yeah. We also I mean, myself experienced having this group of patients who are being referred to us in terms of how to start them and motivate them to physically active. Of course, like for them, if they are not being active for the past 60, 65 years or 70 years, it is very, very challenging. And some more if they have been, not to say sitting bound, not wheelchair bound, but they sit most of the time. I'm sure everyone quite familiar with some, I think in our culture of Malay culture, yeah, they some of the children they wouldn't like to encourage their older parent to move around. They're afraid that, oh, you will get fall. Oh, don't do that. Don't move. You know, there's a lot of so-called restriction, which is actually compared differently in Western country. So from my experience in Australia, most of the older group, they are very active, they are very independent, even they can drive. I have one patient of 85 years old who came to my program, drove from his place about 30 minutes to the hospital just to join my program. So it's totally different. The culture is totally different from their culture with our culture. So again, coming back to the question, how to encounter this? Of course, first and foremost, before you start, do any form of assessment, you need to, to ask the background history first. You know, what level of activity they've been involved before you see them. Understand their what we call that, they themselves, how active they are at home, their environment, if they have any facilities, or at home, whether they stayed at split level or double story, or you need to understand that. And secondly, to know their comorbidities, whether they are diabetes, whether they have osteoarthritis, and other form of diseases. So need to understand that, and also their medication. So from the first thing that you can tell them what to do before you do assessment, encourage them just to move around the house. Don't specifically emphasize on, okay, you need to do 10, at least 10 minutes of walking, or whatsoever, or lifting weights, or even what do you call that? Do quite a difficult movement, which for them is very challenging if they were not active before. So first, just encourage them to move. What I usually will ask them to do, first and foremost, get them to what do you call that? Maybe stand. Yeah, first stand. Take times, because of course we are afraid of risk of fall. Okay, stand beside something they need to hold on. Okay, and then from then itself, just change places from one sitting place to another sitting place. Maybe encourage, why not to change maybe 1 hour, if 30 minutes is too early. So starting from there, okay, while they're sitting, maybe can teach them some simple movement. Raise the hand up without holding anything, just simple hand movement. Okay, if let's say they love to listen to music, just teach some simple movement while listening to music. And then don't force them to do too long. So just, okay, if let's say they're able to do about 2 to 3 minutes, okay, that's fine. But try to encourage if they can do maybe more than one time at one day, and then increase from there. And then perhaps try to, what do you call that? If okay, if for example a week, you want to encourage them, okay, at least once a week, but then consistent. If they can do 3 times a week, perhaps Monday, Wednesday, Friday, make it consistent. Don't for example, one week they able to do every day, every day 5 minutes, but then suddenly a week after, they only able to do maybe Monday on Thursday, or maybe once in a week. So there's already a deteriorating of activity. So don't be too ambitious in terms of encourage them to be active. Start with something simpler and maybe not too frequent in a week, but they can comply. Once they become comfortable, then you may encourage them, why not increase to twice a week, and then give a bit of period of time. Once they feel comfortable, increase to 3. It may take 2 months, it may take 3 months to able, or even maybe a year, to achieve that goals that you would like to ask the older elderly population to do. So again, coming back, you need to have a short-term goal and long-term goal. What is your short-term goal and what is your long-term goal? And then try not to be too ambitious, because you have to remember they most of them are not actively before, and then to prescribe something to them, it will be very difficult for them to comply if they are not familiar. I hope that answered the question.
Yes, thank you for your explanation about to encourage elderly population to be physically active, Prof. Nahar. And then the second question is from Dr. Angelica from Sport Medicine Program. The question is what you know the Dr. Angelica, Prof. Nahar.
Yeah.
Yes, the question is what were the challenges when you present the result of the My Heart study to the Ministry of Education and hope for the education system policy to change? This is my my question for you, Prof. Nahar.
Okay. You know, doing a study is doing a study. When you find something, that's the finding that you get from the study. Okay, this is a very difficult question to answer actually. You know, telling the up, you know, those at the higher level about the finding, to know the whatever that under at the ground level is not good. Most of the times the receiving point, they are not happy, you know. Of course, but in the end they will have their reservation. So from this study, of course, I'm not the principal. I'm not the principal. I'm in charge of the physical activity component. So my colleague, my friend, he's the what we call, he's a dietitian. He's the lead of the project of My Heart, and the co is also my close friend, the pediatrician. So the findings that we able to gather from this study out for throughout 5 years, of course we able to document it and publish it. I'm sure you can Google it actually. My Heart Malaysia. There's one of the what we call that so-called a list where you can look at a number of publications from My Heart study. Of course, we present a lot in conference or symposium in regards to findings. But presenting to the Ministry of Education, that's another thing. Yes, my colleague they presented. Whether it changes the policy, we will need wait and see. But I would say maybe the problems that we encounter is not at every school. Yeah. Just coincident that most of the school that we went to, it didn't so-called comply with what the what we call that the so-called schedule planned by the Ministry of Education. The reason why, because some schools said, oh, they don't have teachers that with physical education background. They also don't have teachers which has what we call that sport science background. So all that teachers that that they have at their school, those are teachers maybe have interest in sports. That's all, but they have other priority. So most of them, of course, because of the school exams, they have to you know, meet their target, meet their KPI, so-called KPI. You know, they have to complete their target. Okay, need to achieve the syllabus. This is until syllabus and completed before the exam. So I think because of that pressure, the teachers which not involved in physical education or sports science, they were not trained for that. And then to fill in the gap, they fill in the session with teaching. So again, to answer the question, yes, presenting is one thing, but implementing is another thing. So in the end, it is up to the school itself. That's what the ministry will say, because of the manpower that in the school that don't have sufficient numbers of PE teacher and sports science teacher. Yep.
Yeah.
I
Yeah.
hope that's answered the question. I cannot answer that directly, you know.
Yeah. Yeah.
Somebody might peeping and listen to me and tell the what do you call that wrong not wrong say about what I've mentioned later.
Yeah. Thank you, Prof. Nahar, for sharing your experience to answer the question number 2.
Okay.
Number 3 from Laili. The question is, dear Professor Nahar, regarding to the physical activity program with voucher rewards, what media did you use to collect the data? Did you have an application, or it was only by the participants' reports? How did you make sure that the participants did really walk?
Okay.
What if they did other activities,
Okay.
especially sports, swimming, and cycling? The time is yours, Prof.
Okay.
Nahar, to answer it.
Okay, thank you for the question, Laili. Okay, the apps that I mentioned just now, actually I've forgotten earlier. It's actually it's a book.com. It's used by, of course, it's available for anybody elsewhere. I'm sure the Indonesia also have that. But for the Ministry of Health, they make that book.com specifically for the Malaysian, yeah. And recently, I think boot.com opened up to quite a number of what do you call that organization what do you call that department, yeah, where actually the voucher is from the whatever bodies that using it. So like Ministry of Health, what they've done, they give a voucher of discount of what do you call that? Because I'm not using it, so I cannot say precisely what actually the voucher. So they able to collaborate with few what do you call that shops or like a sponsors where the whoever they're able to achieve steps, yeah, because book.com able to collect data of steps. So that's where once they're able to achieve 10,000, so automatically they will get this voucher of something. Okay, so that's how it collected the data from book.com. Okay, what happened to those that not walk? Of course, in the end of the day, for that particular reason, for that particular what do you call that what do you call that monitoring of book.com, so they don't collect data of swimming and cycling, unfortunately. So in the end, they have to walk. Okay, but for ours, of course, we don't have any specific apps unless if for our BFIT, we use Strava apps. Actually, everyone can upload this for those that we can monitor. So we monitor from Strava. So because Strava, you can have quite a variety of activity. If for step, we just purposely use any step. We have actually a competition where 1 month we ask the participant to collect their steps throughout for 1 month using special apps that available in the Google Play. We just choose one which is more for us more reliable. Then we ask the participant to download the apps. Okay. For other form of activity, it's just a documentation. Yeah. But in the end of the day, it's about assessment, pre and post. So we encourage them to do any form of activity of exercise, of course under supervision with us at least once or twice, or if they have their own activity, other activity, they can add on as their routine of activity. They can document it. We give them some. We will give them a diary for them to document their program. But how we measure, as I mentioned just now, we do blood tests, and also we do all the fitness tests. Fitness test with body impedance analysis at 3 point. So then we what we call that, we see the progress for the last 3 months and 6 months, and from there we able to so-called see how much they improve. So we will look at in terms of percentage of the individual, percentage of improvement of their fitness level, and percentage of their what we call weight or fat. We not just see how much they reduce their weight, but of course, in terms of looking at how much they're able to cut down their fat mass and reduce their percentage of body fat. Yeah.
Yes, thank you very much for your answer to Laily's question. And this is maybe the last question for Prof. Nahar. From Dr. Indra Risukoto, sport medicine specialist. The question is there a physical activity program at school models in Malaysia due to increasing physical activity level in children? Yes.
Okay.
How about it?
Well, from my observation and my understanding, Ministry of Education, they actually already have some program. They already have actually a program, what we call that, structured program for the school. So for year 1 of secondary, year 2 secondary, year 3 secondary, so what are the form of activity? So they make it as a syllabus. They have it as a syllabus. So to answer the question, yes, it has. So it's actually in terms of a syllabus for the year of what we call that, a school, for example, for secondary school. But how much it's been implemented and it's been conducted, that's also another issue. Because sometimes, okay, for example, the model, there's a syllabus where, for example, okay, badminton. So, and then they will try to introduce how to do serving, how to do, in terms of the technique of playing. So from then itself, some may interested in badminton, some not. So those are not interested may not be able, may be so-called keen, because some school earlier they are quite strict to the syllabus, but I'm sure lately now they're quite open, loosen up. So those are not keen on doing certain activity, they can allow to do another activity. But the problem that will be encountered, where, as I mentioned earlier, is the teacher that's supposed to conduct the session, because not many of them, so they may have some kind of issue in that. So if not the right teacher, basically maybe the relief teacher, when they covering the physical education, physical activity session, they may just let the student do their own things. They want to play, they want to sit, or maybe they just what we call that, chase around. So it's just that, and give them ball, just play or something, that for until that extent. But in general, now in Ministry of Education, for school, they have a so-called a syllabus on program conduct conducting the physical education program during the session twice a week. Yeah.
Yes, thank you very much for your answer, Prof. Nahar. Maybe I want to short the time because we have exit the 30 minutes from the schedule, Prof. Nahar. I want to thank you very much for your lecture, for your nice sharing experiences. In the chat room, there are a lot of questions, but due to the time, we have to stop in the 5:30, Prof. Nahar. And I want to apologize to the participant that who have sent the question to Prof. Nahar. Because of the time, we have to stop now. And before we finish before we close this session, we want to take a picture for documentation, Prof. Nahar.
Okay, sure, no problem.
Yes, I want to ask a resident maybe who want to help us to take a picture.
Izin mengambil gambarnya, Dok.
Yes,
Yeah.
Silakan. Terima kasih, Dr. Andi.
Dalam hitungan 3, mungkin semuanya membuka kamera terlebih dahulu. Oke, baik. Siap, ada 2 kali pengambilan. Ada, 57 berarti 2 kali ya. 1, 2, 3. Baik, sekali lagi. 1, 2, 3. Baik, sudah, Dok. Terima kasih.
Yes, terima kasih, Andi. Yes, thank you very much. I want to say again to Prof. Nahar for your lecture today, and I want to remind to all the resident of the sport medicine residency training program, we have a big challenge in front of us to cope with the physical inactivity people, to make our nation healthier and kuat, more powerful. Thank you, Prof. Nahar, for your lecture today, and I hope we can meet again in the next opportunity.
Inshallah. Thank
Ya,
you
Terima kasih
for the
banyak,
invitation.
Prof.
Okay, thank you. Terima kasih semua.
Ya, terima kasih.
Ada Dr. Leni juga, Prof.
Ya,
ada,
kelihatan
ada.
Dr. Leni. Ya.
Ya, terima kasih semua yang sudah menghadiri acara guest lecture hari ini. Saya tutup. Saya mohon maaf apabila ada kekurangan. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Thank you, Nora.
Salam.
Sudah bisa.
Itu belum ya? Oh, belum dimatiin.